All right, let's go ahead and start. So thank you everybody who's joined. It's nice to see your names and we're excited to share with you. This session is planting seeds of change, improving health outcomes through gardening and greening in urban areas. And the conversation is really going to focus on the Pennsylvania Horticultural Society and its partners and the communities it serves to try to use gardening and greening as a means to improve health and well-being across this region. And before we dig into it, I wanted to introduce myself. I'm Matt Rader. I'm the president of the Pennsylvania Horticultural Society, and also introduce Loree Jones and Dr. Gina South. So Loree, do you want to introduce yourself briefly?
Absolutely. Good afternoon. Thank you so much. Matt, thank you so much for this opportunity. I serve as CEO of Philabundance, actually started here in June. Philabundance is the area's largest hunger relief agency. Historically, we provided healthy meals and food to about 90,000 people a week across the 9-county region. That includes the 5 counties in southeastern Pennsylvania and 4 counties in South Jersey. We work to both relieve hunger now, providing meals and food to people now, but also to end hunger for good through workforce development and partnerships to address the root causes of poverty. In addition to that, I'm a very proud member of the board of the Horticultural Society, and so I'm particularly pleased to have this opportunity to talk about the partnership between our organizations.
Thank you, Loree. And Dr. South.
Hi, everyone. It's a pleasure to be here. My name is Gina South. I'm an assistant professor of emergency medicine at Penn. So I see patients and work clinically at the Presbyterian Medical Center Emergency Department. And then I spend the majority of my time doing research. And my research is focused on neighborhood environments and how neighborhood environments impact health and safety. And I have a particular interest in urban greening and urban nature and how we can leverage urban nature as a community health tool. I've been working with PHS since 2010 when I moved to Philadelphia to be a research fellow. I met Bob Grossman, who used to run Land Care at that time through my mentor, and spent a lot of time with Keith Green, who now runs Land Care. He knows every single block in Philadelphia and drove me around West and Southwest Philly, sort of introducing me to different communities and neighborhoods and pointing out every single vacant lot, whether it was greened or not greened, and who greened it.
Amazing. Thank you. And Gina, you also sit on PHS's Strategic Oversight Committee for the last 6 months or so since we got started. Mm-hmm. Awesome. So I just want to give a brief introduction to PHS and our work, and then we're going to really engage in conversation with Loree and Gina. So many of you may know PHS through the Flower Show, but the purpose of PHS today is to use horticulture to advance health and well-being of the greater Philadelphia region. And to do this, we look to design to implement solutions that use horticulture to address 4 social determinants of health. So getting people connected to one another, creating healthy living environments, ensuring access to fresh food, and creating opportunities for employment and business development. And the kind of tools we use are many, but community gardening, vacant land cleaning and greening, gardening public spaces, job training and placement, and also using things like the Flower Show to promote ideas about how horticulture can be used for social impact. We're very much an organization rooted in partnership, so tens of thousands of members, volunteers, neighborhood residents, institutional and organizational partners, funders, et cetera. And we try to work collaboratively so that these people come together with PHS to design and implement solutions. And our work today stretches around 250 neighborhoods across the region, where we work very hard to try to understand community aspirations and support community residents to make change. We're supported by members, government, foundations, corporations, partner contributions, volunteer hours, whatever somebody's got, we try to put it to work through horticulture for the benefit of the region. And it's important to note that we believe pretty strongly that horticulture belongs to everyone. And we've been taking some really intentional steps over the last 2 years to try to evolve ourselves into a more diverse, inclusive, equitable organization that really reflects the people of this region and city working together to serve the people of the region and city. And we've been working really hard to understand how we're perceived, how we work to increase the diversity and inclusiveness of our staff and board and committees, make sure that we are a culture where every voice is welcomed and able to influence how we work together. And then more tactically, we've been trying to look at how to use data to make sure that our work is focused on the issues and the places that can most benefit from the kind of impact that horticulture can deliver. And Gina's been a help in that. So this work will continue over time, and we're working closely with Dr. Tiffinia Archie at Temple University to try to chart a course to becoming an organization that really embraces and embodies the principles of diversity, equity, and inclusion and uses them to make positive impact on the region. So we're going to dive into lots of different topics, but I wanted to start with a question for Gina, which is how do you connect your work as a clinician to your research on the health effects of greening? And then tell us a little bit about what are the most important insights from your research to explore upstream causes of the downstream health challenges you see in the clinic.
Yeah, so when I was an intern working on the trauma service, we had a lot of shooting victims that would come in. They were often young Black men, and we did a really good job taking care of their physical injuries. We went through, the ABCs, sort of protocol every time someone comes into the trauma bay to take care of them and treat their injuries. Maybe they had to go to the operating room, maybe they didn't. But we did very little to think about and address the reasons why they were coming into our emergency department in the first place, and why people we would treat and send home may come back the next year and the next year after that being a shooting victim again. And so I got very frustrated with not really being able to, in the clinical space, to ask those questions and to figure out the answers and to do something about it, to really get to the root causes of why we were seeing so much violence. And that led me to want to do research in violence prevention. And so I was fortunate to come to Penn and sort of with a broad picture of wanting to do something in violence prevention, got paired with a mentor, Charlie Brannis, who was just starting to work on sort of place-based interventions for violence prevention. And over the years, that's what led me to working very closely with PHS, and we've studied the land care intervention, demonstrating an impact on violent crime, on feelings of depression. And so seeing in the emergency department, I see the very most downstream impacts of poor health. People come in with high blood pressure, with diabetes. And then in my research world, I'm able to step back and really ask, why are these things happening in the first place? Why are they patterned by where people live, patterned by race, and ask those more upstream questions. It also goes in reverse, because things that I learned in my research, so after doing all this work on green space, what I've started to do is to actually talk to individual patients about it. So I had a woman who came in maybe a year or two ago with chest pain. We went through a workup to make sure it wasn't a heart attack, a clot in her lungs, things like that. But we didn't find anything. And I said, well, you should follow up with your primary care doctor. But have you been stressed out? How have you been lately? And then she started talking to me about different levels and layers of stress she was experiencing in her life. And we talked about that could be contributing to her symptoms. And I asked her, do you ever spend time in a park or in green space? And she said, no. And I said, well, it may not change anything, or maybe it would give you some stress relief. So I suggested to her to try it. And then she immediately started thinking, oh, well, I can go to that park, I can go to this park. So we were able to sort of make a plan for her to go spend some time outside. In the emergency department, we don't have follow-up with patients that often, so I don't know if she did it or not, but it's very all connected for me, sort of thinking about the upstream causes of illness and then all the way down to the patient in front of me who's sick.
Fantastic. Thank you so much for sharing that. So Loree, you work in food security as your issue. How do you see food security issues negatively impacting the health and well-being of people across the region? and how is that situation changing in the midst of COVID?
Yeah, great question. And it's really great to hear Dr. South explaining how things are all interconnected. And I think that's the reality. And what we're talking about today is partnerships and collaboration, and realizing that there's not one problem that's connected, and really thinking about how we as various partners can come together to address our piece of it, but then work together for a collective solution. And so with respect to food insecurity, I mean, I think we're seeing, first and foremost, as it relates to equity, and we're seeing what everybody else is seeing across the country. There's been an awakening over the summer, and people are now becoming more and more aware that these challenges that we've always thought about, kind of around food insecurity, around poverty, lack of educational access, that those really are connected to the systematic issues of racism that we've had in this country for years. And so that definitely is something that we think about and we definitely bring to our work. In terms of what we're seeing in terms of how many people in our region are food insecure, I'll tell you a pretty startling number. Back in 2018 or 2019, last time there was an actual count, 560,000 people across our region were food insecure. So that meant that at some point in the course of a day or a week, they didn't have access to the healthy food that they needed for a basic lifestyle, right? 560,000 people. In the city of Philadelphia, that's about 250,000 people. In a place like Camden County, that's about 52,000 people. And I bring those up because I think it's important for us to know how broad that is. And then to say that in response to COVID, we've seen COVID and the accompanying economic crisis that we've seen, those numbers have only gone up. So we're seeing, while we haven't done the official count this year, as you can imagine, what we're seeing across this region, what we're seeing in the Feeding America network across the country, is an increase of up to 60% of people who are accessing the charitable food network. So I started with 560,000 people. 60% more we're seeing that are needing to access food. So what we're seeing is just dramatic increases in folks that are food insecure in this region.
Enormous change, really, really significant.
Yeah.
So, Loree, you touched on the history of racism in this country influencing the outcomes you see in your work. And at this moment, so many of us are really confronting and trying to learn more about structural racism and the inequities it has created. And Gina, to share with us, if you could, a bit about the historical antecedents that have built structural racism into the region's urban fabric and help lead to health inequities.
Yeah, so this is a topic I feel very passionate about, so I'm really happy to talk about this. So I think when most people think about racism, especially before George Floyd was killed and our country sort of erupted in protests, when people think about racism, they often think about only interpersonal racism. So, one person not liking or taking actions against another person because of their skin color. So they really think of individual one-on-one actions. And that is, of course, a problem still in 2020. But the bigger and more invisible problem is structural racism. And so that's what I want to talk about, and as Loree mentioned. So structural racism is really a system of policies, so laws, institutional practices, how different institutions practice, cultural representations and norms, what we see on TV, what's represented in the news, that all work together in reinforcing ways to perpetuate racial group inequity. So the policies and practices really serve to allow the privileges associated with whiteness, and there are privileges associated with that, and the disadvantages associated with color to endure and adapt over time. And those advantages really have to do with concrete things like money, power, and opportunity. So when you think about something like food access, that is about all of those things. It's about money and opportunity for food and food access. So structural racism is not something that just a few individuals choose or don't choose to practice. It's actually just the fabric of the society in which we exist. And so you literally can't escape it. What makes it tricky, of course, is that if you're not looking for it, it's invisible. People don't even realize that it's happening if they're not looking for it. And particularly if you benefit from it, people tend to not want to see the ways that they actually benefit and that other people are harmed. So I want to just give you sort of a concrete example of what I'm talking about and link that to our present day neighborhoods and the way our neighborhoods look and feel. And that is with redlining. And so redlining was a practice that really started in the 1930s with the creation of the Federal Housing Administration that was created under FDR as part of the New Deal. It was pretty revolutionary at the time. It sort of set the standard for what we today think of commonplace for home buying. So thinking about that 20% down payment, that sort of standard, that was actually something that the federal government created. It used to be higher, which prevented people from being able to buy homes. Being able to repay a loan over 20 to 30 years, which again is the standard today, that did not used to be the case. And then the federal government guaranteeing mortgages. And so what all of this led to, along with other factors, this is a bit of an oversimplification, but for the purposes of today, what all of that led to was that it became much easier to buy homes. So you had the creation, that along with the building of highways, you had the creation of the suburbs, people leaving cities. But 98% of the loans that the FHA backed went to white buyers, 98%. So Black people were essentially cut off from buying homes. And that's, a prime way that we build wealth and bring resources into our communities. And the term redlining, what it means is actually literal. So the government, that's really important to know, this is our federal government, went to all neighborhoods across the country and determined which neighborhoods were eligible and which were not. And the ones that were not were highlighted in red, and hence the name redlining. And the main thing that made a neighborhood not eligible was having Negroes or foreigners, which that's the actual words from the policies from back then. And so that combined with other private practices with banks and real estate agents like block busting, racial covenants, it was written into the deeds of homes that you could not resell your home to a Black family, for example. All of that sort of worked to determine who got to live where and what neighborhoods had financial investment in them or not. And so you end up having white, well-off communities and Black communities that had decades of disinvestment and decline. And so when you think about where are the vacant spaces in our city today, they are primarily in Black and brown neighborhoods, and that is a product of history.
Thank you, Gina. Loree, how do you see structural racism manifesting itself in your work?
Yeah, so I'll give you some more stats, right? So according to Feed America, which is our larger kind of umbrella organization for food banks across the country, African-American households are face hunger at a rate of twice that of their white and non-Hispanic counterparts. So twice as many Black people in this country are food insecure. And then getting enough food to eat is more of a struggle for 1 in 4 Black parents. 1 in 4 African-American children. So that's across the country. And then here, from a couple of years back in our service area here for Philabundance, of the people that we serve, about 47% of them are Black, identify as Black or African-American. So clearly, I talked about those huge numbers of people that we're serving. A huge number of those people, a huge percentage of them, are then African-American within that for many of the reasons that Dr. South just outlined.
And I think I would just add to that, when you think about that number, I mean, it's astounding. 1 in 4 Black children are food insecure. There are very real consequences to that. And so when you think about when you're hungry at work, it's hard to focus. It's hard to concentrate. You're really focused on when can I eat next. Your mood is changed. And so if you're in school trying to learn and you're hungry, that's going to be a barrier to learning. If you are not getting the proper nutrients that you're supposed to get, and if you, let's say, have a diet that's high in sugar, because often those are cheaper foods for families to buy, that's going to have an impact on your teeth and your ability to have healthy teeth, which then impacts your health. Actually, our oral health has a big impact on our all aspects of our health. And so I just want to very clearly lay out the links between the statistics and the very real impact that has on people and particularly on children.
Yeah,
So,
that's
Gina,
sorry, Matt. I can follow up on that. But no, you're exactly right, Dr. South. I'm glad that you kind of outlined that for people, why it even matters. So there is, on the flip side, there's some good news, right? At least in terms of our network. So I talked about kind of the bad side, how many people are food insecure, how many of them are people of color, how many of them are African American. We also do the work that we do through a network of 350 agencies across these counties. 350 agencies in virtually every neighborhood in these counties, and that really is a diverse network itself. And so when I think about the people who are partnering with us on the solutions, they're also as diverse as the people that we're serving.
that's very good to hear. So actually, just Dr. South, to go further on the path you were on, in a lot of our work at PHS is based on this concept of social determinants of health, that there are physical or intangible things we can change about people's lived experience that will positively impact their health. In layman's language, can you introduce the concept of social determinants of health?
Yeah. So when we think about health, there's your genetics and your biology, and that is, something you're born with. But almost everything else that impacts your health is a social determinant. It's the conditions in which you live, the conditions in which you're born, that you age into, the conditions that you work and play in. And by conditions, anything you can think of, it basically is a social determinant of health. So, the food is a very clear one. Education. Education is a social determinant of health because our ability to be educated and have access to good education, that sort of sets up further opportunities that we have in life that all then has an impact on our health. Our ability to access healthcare, of course, is part of that. Economics, so socioeconomics, just thinking about income, both income and wealth, that are very much patterned by race in this country, are big social determinants of health because they have direct impacts on health. Even though when we think about economic policy, we're not often thinking about health or the impact that that's going to have on health. But all policies do have direct impacts on health, whether we sort of recognize them or not.
So then, regardless of the excellence of clinical care, if the lived conditions and the intangible and economic conditions are inequitable, the health outcome will continue to be inequitable and not good.
Yeah, I think it goes back to sort of the stories that I told in the beginning, and honestly, a realization for myself going through medical school and realizing that the clinical care that I was providing for people, at the end of the day, when you think about sort of the population level health in this country, has a relatively small impact on people's ability to be healthy. And, I'm a physician saying that, so we really, when we think about health, and even as healthcare providers and health systems, when we think about health, we really need to think broadly. If the goal is to have healthy communities. Now, I don't think everyone doesn't have that goal. But if your goal is to give people the best opportunity at health and wellness and well-being, we must think very broadly.
Thank you. So that leads into a question, and Loree, maybe you could take the first pass, which is facing a really immediate health crisis in this country that is also surfacing a lot of long existing inequities in health. And your work is very much at the front line because food insecurity is rising. How do you see your work changing right now in response to all the conditions we've experienced this year, from health to increasing awareness of structural racism and other factors?
Yeah, I see, what's happening now, reminding us and putting at the forefront how important the work that we do is. And so what I mean about that, we think about our work here at Philabundance in two ways. We think about feeding, which means that those people, that 60% more people that need food, ensuring that they get access to fresh, healthy foods now. And we at Feeding America, at the Feeding America Network, and here we prioritize donating food, distributing food that is healthy. We try to limit kind of extra sugary food, limit sodas, those kinds of things that people sometimes donate, but we try to get fresh, healthy food to people now, relieving hunger now. The other thing that we really want to do is also to address the root causes of poverty through a program we call Ending Hunger for Good. So about a year and a half ago, we kind of reorganize ourselves to really focus on this work. Workforce development work. We've been in that space for about 20 years with a program called PCK, the Philabundance Community Kitchen. When we just last week opened a brand new space right in North Philly, 18,000 square feet, teaching kitchen, classrooms to ensure that more and more people have access to that workforce development life skills training program. The other parts of the Ending Hunger for Good, we're doing some place-based work. We're partnering with people to address the root causes of poverty, many of which, as you know, and as you just said, are related to the social determinants of health. Now, we know what we do well. We know that we've been running this workforce development program. We know that we're able to get food out to people through our networks, but we also realize that we're not doctors. We realize that we're not necessarily, we're not K through 12 educators. We're not housing experts. And so one of our core values, as we're talking about today, is collaboration. We realize we can't do it alone. So a big part of what we do is we sit around a table virtually at this point with the experts from those various areas, and we are co-creating and co-designing with them what the solutions are to address these root causes. Our goals are really to move families from crisis to thriving. And so in a neighborhood, let's say Sharswood neighborhood, we're working with the Philadelphia Housing Authority, with a charter school in the area, with a federally qualified health center there, with Habitat for Humanity, and I encourage people to check out the Inquirer with Episcopal Community Services. There was a recent feature on a program called Mindset. We work with them on that. What piece of it is Philabundance's? How do we bring food to the table for that? What's Housing Authority bring to the table? What's Habitat bringing to the table? And so for us, we're really working to address these root causes of poverty, which similarly are affecting folks' personal health and wellness, by looking at the pieces that we can control. In addition to that place-based work, and we hear this happening, we also are working with other governments as well. The Department of Human Services, for example, is really prioritized this work. So we're working with area MCOs, with managed care organizations, we're working with health partners plans, working with others on task forces to address the social determinants of health, and again, say, what's our piece of it? So what we're seeing and what we're a part of are these collaborations to address these issues.
Thank you, Loree. Gina, any ways that your work is changing right now in the midst of all things?
So of course, moving everything virtual, and we've had to postpone some research studies. But I think the biggest thing is, my work has for a long time been focused on aspects of the environment that have been impacted by structural racism, and I'm sort of doubling down on that and just sharpening the message and really trying to connect the dots for people on the sort of historical underpinnings of why things are the way they are today. So I've been trying to do that. I also think, I've been really encouraged to see a renewed recognition of the importance of urban nature and green space in our lives during the pandemic. It really is one of the safest places to be with other people outside, and with direct impact on our mental health and our ability to handle some of the stress that comes with the pandemic. And it also has highlighted some of the disparities in access to clean and green space. And so I am encouraged to see that people are talking about issues of access, issues of environmental justice more. And I think that the final thing, something that my work has not focused on, but maybe will go in this direction, is the experience that people have in green space and nature, and how we can ensure that all people are welcome in all spaces. If you remember back to in May, there was an incident that was recorded on video with a birder, Christian Cooper, in Central Park, which I think was the first time a lot of people saw how a Black man may actually get threatened in a public green space for simply really existing in that space. And so I think that is an important thing to think about as we're talking about access to green space and who is sort of welcome where.
Matt, you're still muted.
Thank you. I was trying to manage feedback. Any other thoughts Loree, from you on other horizons you all are trying to advance in health and well-being, or new problems you want to unpack and solve that have come to mind given the current focus on structural racism and health, et cetera?
Yeah, I mean, I would say take it, related to that and then just broader. And I know and hope we'll have a chance to talk about our partnership, Harvest 2020, and what that means. And that's something that, obviously at this moment, it's important for us to think about. And so it is important for us to think about ways of partnering with and co-developing and designing solutions with the people that we serve. And so that's about like kind of what kind of food do people want, and is there an opportunity for people to grow that food? And so that's something that we're thinking about more and more. The other challenge for us in 2020, and I have to mention this because I think we've all experienced is really we all experience the challenges with the food supply. So you think about it as individuals. If you weren't in food banking, as I wasn't early on in this process, if you went to the supermarket, right, you found it was harder to find very basic things, and things you found were more expensive. There were challenges with the food supply. And so what that meant for food banks like Philabundance is we started, I had to look in different places. I had to pay more money and buy more food than we had that would have historically been donated. We also, working with governments, have partnered more directly through government with farmers. And so one of the things that we have to continue to think about is like who's growing the food, right? And how do we work more directly with them? And we're thinking about that on a larger scale at organizations like Philabundance here and across the country. But I think also as we talk about Harvest 21, we'll think about that on the smaller scale. How can community farms, community gardens, how can we encourage everyday gardeners to grow food that then could become part of the charitable food network?
So let me just come to that a little bit more. So Loree mentioned Harvest 2020, which was an initiative that PHS and a number of partners, including Philabundance, funded, including Independence Foundation, the Delaware County Foundation, and others, dreamt up in Subaru this year to try to actually look to home gardeners. And we know that something like 70% of U.S. households participate in home gardening, to look at gardeners as a potential source of food, and looking more broadly, other sources of collective impact, all of our health and well-being. So if you really open your mind up and you imagine 70% of households doing something that improves our water supply or increases the tree canopy or improves the attractiveness and safety of our streets, like there's really amazing collective impact that can happen if you can mobilize a lot of those people to do something. And Harvest 2020 was this experiment to try to mobilize them to both grow food and share food, both with their friends and families, but also through food distribution agencies across the region with people in need. And was among the partners that stepped up early to partner with us on this. And so maybe just touch on why that project was of interest to Philabundance and how as your point of view.
Yeah, for some of the reasons I was talking about in my last response to you, this is Harvest 2020 is such a great democratic way, everyday way for people to help folks. And one of the things, we're the beneficiary here at Philabundance. We have so many people, I'm sure some people watching are donors. People give us $5, $5,000. Folks want to help their neighbors. And so here's another way that Harvest 2020 provides for people to do just that. And so I think to date, we've had about close to 5,000 pounds of food that our neighbors have grown that have then gone to food banks and then gone back out to neighbors who need it. And so it's a way for everyday folks to contribute. And then, as you both know better than even I, they're the benefits that people feel when they're gardening. So they're kind of health benefits for the community, health benefits for kind of the society and the neighborhood, as well as for the individuals involved.
Awesome. Thank you. So, Gina, I'm curious. I'm getting feedback. Sorry, to build on that, if you had something that you could ask a lot of U.S. households to do that would help use gardening to advance priorities around health and safety, what would you ask?
I would ask for people to think sort of broader than their own home or their own block or even their own neighborhood, and to sort of think of their city or region and ways that they can use their skills, their resources, and and influence to create opportunity for others. So for example, if you are really good at planting and growing trees, helping neighbors in a different neighborhood, maybe who doesn't know how to do that. If you have, resources to be able to buy the supplies that you need to start a garden, finding others who maybe want to do it but don't have the resources. And so to really, similar with food and growing and sharing food, that same spirit of really using what you have to help others on an even broader scale.
Awesome. We are ready for people to be tree tenders or otherwise support the work. So let us know, and we'll dream up more solutions together. Gina, you have been a real advocate for innovative efforts to create green space and also improve the management of underused spaces in neighborhoods. The largest example being Land Care, which is our partnership with the city of Philadelphia at PHS that cares for 12,000 lots at this point. This is a time of dwindling budgets in all levels of government and also in the many private sector areas. How would you make the case for investing in greening, which we all know is sometimes considered to be kind of a nice to have and not a fundamental? So how do you make the case? Does it really matter?
Yeah, so I think the first thing is exactly what you said. Green space, whether it's tree canopy, parks, other clean and safe green space, it is not a nice to have amenity. It is actually vital for supporting healthy neighborhoods. And so if our goal is to create healthy neighborhoods and to give people the sort of best chance at life, then greening and green infrastructure really needs to be part and parcel of how we think about a just and equitable recovery from COVID. And so, if you think about something like jobs, I mean, a lot of people have lost jobs. People need jobs. And one way, for example, could be if we think about building our green infrastructure in Philadelphia, and tying that to job training and jobs, there is an opportunity to address an immediate need with income and jobs, and with a longer term need, which is green infrastructure. The reality is we're living in a time of climate change. We are seeing that now with storms and fires and flooding, and that's not going away. And so part of the way that we can buffer against that in our city and in cities across the country and places across the country is building up our green infrastructure. And so that is going to be, vital to the long-term sustainability of our society. And so we need to, even though we are in a very tight financial times, we can't lose sight of the longer issues and problems and goals that we have. But we need to just tie them back to the immediate needs that we have also.
Thank you. All right, and then sort of a rapid fire question for both of you, and then we're going to go to some audience questions. So start with Loree. What's your personal relationship with gardening?
So as Matt knows, I tout myself as a future master gardener. And so as a proud member of the Horticultural Society, it definitely is something I'm committed to. But that also is in my family. It's in my blood. So my mom has these amazing monster aloe plants, and she's the one who always reminds me that when I water my plants, I have to talk to them. And my grandparents were gardeners as well. My grandfather was the lawn guy who literally was in tears when I took him to Longwood for the first time at the age of 92. And so definitely it's something kind of like gardening and lawns and plants is something that was, always in my family. I love Longwood, but I bring that up, that example up, and Matt's heard this, an African-American male from South Philly who became a lawn guy, became pretty successful, but at 92 literally was in tears when he went to Longwood because that was something he didn't see that he had access to. And so as we're thinking about greening and gardening, people of color, African Americans, Indigenous people across this region, but across the world have always had a close connection to the land. And yet sometimes as we've talked about it recently, we've talked about it in ways that are like patronizing or kind of separate. And so I think there's a real, and I know PHS embraces this, I think as we're talking about gardening and thinking about it, let's make sure that we're doing it in a way that is in fact inclusive.
That's great. And we, for the record, talk about gardener as anybody who cultivates any plant anywhere for any reason. So if you touch it, you're a gardener. All right. So Dr. South, what's your personal relationship with gardening?
So I will be honest and say that I have historically had trouble keeping plants alive. But it's actually funny, Loree, that you said that. I came to the realization maybe about a year ago that in order to keep plants alive in my house, I had to actually pay attention to them. And so, so I started watering them and maybe not talking to them, but looking at them every day, examining the leaves. And so what before was very haphazard, just sort of watering what I remembered and then probably overwatering, I've become much more scientific about and actually paying attention to my plants. So my track record in the last year has been excellent. I think I have maybe 8 or 9 plants that are alive in my house right now.
Thank you. So couple questions from the audience. So there were 2 questions from Ken and Addie that revolved around funding for green space, new green spaces, tree canopy, jobs working in green space, et cetera. And what is PHS and others doing to try to increase that? And the simplest answer is the city's resources for investing this are severely limited. And in the current crisis, they're facing even greater limits. So the approach PHS has been taking is to try to put really strong emphasis on private philanthropy and corporate sponsorship and gather those funds and make sure that they're invested in community green space. And 2 really concrete examples are a fund we raised from individual donors for supporting community garden groups in the process of governance, education, supplies, materials. And that fund is now providing about $200,000 a year to support that work. And then this year, we launched a similar fund for tree planting and stewardship with a focus on low canopy neighborhoods with inequitable health outcomes. And that fund is also providing about $200,000 a year for 3 years for that work. So for us, the short answer is, of course, to continue to partner with government to secure money for this work, but more importantly, to turn to all of us as potential sources of funding at any level and to try to gather that money and channel it into supporting, in our case, community garden groups, neighborhood tree tender groups, job training through Roots to Reentry, et cetera. But we need more resources to do this, and government simply can't be the only answer at this point. So trying to turn to members from $30 a year to how much ever you can give to support this work. Gina, Loree, don't know if you have other thoughts on sort of work and approaches being done to increase the resources and the sustainability of this kind of work.
I think that, Matt, you've laid out, and I think especially with the research of Gina here, you've made the case for why this is an important investment. I think that's something that we need to continue to do, even as resources are dwindling. As you said, this is not a nice to have, this is necessary. So if we want individuals to be healthy, we want communities to be healthy, we need to invest in this way and in organizations like the Horticultural Society. And I think you're making that case. We need to continue to do that. So yeah, resources, how do we make sure we still have the support of government that we need, but then also where else in terms of the foundation world and kind of private philanthropy and individuals. I think as we tell them the story and help them understand the importance of it, and then ask them the question you just asked us, all of us have some connection to greening and gardening. I think that more and more folks will support this critically important work.
I think another area is within healthcare. A lot of money has been put in recently in the last, decade to social determinant of health interventions. Most of those interventions really target social needs, so filling the most immediate need. But I would really like to see health systems and payers, insurance companies, paying for some more of the infrastructure, the green infrastructure, parks, green schoolyards, tree canopy, that we know has an impact on health and ultimately could be beneficial for the members of a particular payer or health system. There's a lot of there's a lot of issues and things to unpack there, but I am, trying to work in those circles to also get funding that way.
That's terrific. So big theme of trying to add to the resources coming into this. And PHS is certainly making its best effort to be an aggregator of those funds and then distributing them in support. And for those of you who know us, our membership, our donor programs, and the Philadelphia Flower Show and the pop-up gardens all generate north of $2 million a year that get reinvested in these programs. And so it's all about trying to aggregate money and direct it in the right way. There were a couple questions about preservation of community gardens and land swaps with developers, et cetera. And the shortest answer to that is PHS has an affiliate organization, Neighborhood Gardens Trust, that advocates and actually manages transactions for community garden groups to permanently preserve their sites and has been doing a lot of advocacy with the city to try to improve that process, which has been complicated in Philadelphia for a lot of reasons. And I think this is also an area where advocacy for community gardens is not a nice to have, but an essential part of neighborhood infrastructure is an important argument that each of us can make. And I think the questions about whether developers can be engaged in creating green space is a path that we've been doing some thinking about, how to both advocate for developers to plant trees, create green space, set aside land, incorporate it into developments, and then also look at zoning code and other issues to actually incorporate green and growing space. So there's much opportunity to grow there. There was a question, I'm curious for both of you, that was about programs in other cities that inspire you in this area, using greening for health and well-being. Anything that you look at and you think, gosh, I really wish we had that here?
There is a woman in Baltimore named Atia Wells who runs an organization called Backyard Base Camp. And she's actually a nurse, but who herself was sort of inspired by her own experiences in nature and has been working with a community in Baltimore to bring kids to a space that is actually a vacant space that they're developing and revitalizing a trail and other aspects of nature there, and really just teaching kids out in nature and letting them explore. And we have programs like that in Philadelphia as well, but I really draw inspiration from programs that are really connect children to nature, because kids love getting messy in the dirt and seeing, the joy and inspiration when they get that connection is awesome.
So I believe that PHS is where it's at. I think that people across the country are coming here to look at what programs, the great programs PHS has developed. So I think, we really are a model in this city and in this region because of the work that PHS has done. So I think that's important to note. And so I hope that everybody watching will visit the PHS website to learn more about these programs and gardening for the greater good. In terms of what I do every day, my day job, there are food banks across the country that are doing really innovative work. I would highlight one, and remember I'm new here, so I haven't had a lot of chance to do research and definitely haven't been out to visit. But I think that my kind of counterparts in the Washington, D.C. area have worked more directly with farmers to take their excess crops and put them in the charitable food network. And so definitely something we want to explore more is thinking about ways to work more directly with kind of these larger farmers, but even smaller ones. I think that's a great opportunity for us to address food insecurity in our region.
Loree, a question for you, and Dr. South, you may have thoughts as well. The question was, eating healthy can be expensive. What's being done to try to make healthy food or healthy eating affordable for families?
So I will remind folks that one of the things we've prioritized here and across the network is really to ensuring that the food that we give out is as healthy as possible. So we try to limit any donations. We say, here's our preferred list, so to make sure that what we're giving people that's free isn't just junk food or sugary food, et cetera. So that's something we definitely prioritize here, but we also are not the food police, right? So we definitely want to make sure that we're giving food out that it's as healthy as possible. Where possible, we're partnering with folks to ensure that we're providing produce. That's been a big part of our budget this year, has been purchasing produce to get that to people. But the other thing that I'll note with respect to kind of eating healthy is a big part of this work is really advocacy. And you mentioned that in terms of letting people know about the importance of green space. But I talked earlier about kind of the numbers of people that are food insecure. As strong as we are and as incredible as the Philabundance team is, as wonderful as our donors and partners are, we cannot alone ensure that everybody has food. Right. And so we do need to rely on government. We are constantly, September is actually Hunger Action Month. And so we are encouraging people to advocate to support federal programs that provide people with more food. Now, why is that an answer to your question? If we had, say, a 15% increase in SNAP and the Supplemental Nutrition Assistance Program, then individuals would have essentially money to go and purchase food for their families. And they would be able to make choices. One choice. I'm sure like all of you, I get to choose what I purchase for food. I get to choose at restaurants. So providing people with choice, it also is great because it spurs local economy because they're spending money, but it also allows them to purchase the healthier food and to really supplement the cost that the person's asking for in the question. So I would say yes, and we do find that kind of eating healthy tends to be a little bit more expensive, but if we can provide people with those resources through programs like SNAP, we should. And then part of what we're talking about here, when people can either grow their own food or share food that they've grown, I think we can start to chip away at that.
So go ahead, Gina.
I was just going to say, just to add to that, and sort of bringing this back to structural racism and sort of structural causes of poor health, that having the number of people that we have in this region and in this country that are food insecure, that is a choice that we are making as society, as our country, because we know how to help people get food. We know that if we give people more money through SNAP benefits, for example, that's just what triggered that thought, that we can easily give people enough resources so that they can have access to food and make the choices of what they're going to eat. So, but we have decided that we are not going to do that. And part of that is the way that we frame programs like SNAP as people being either deserving or not deserving of assistance from the government. Whereas if we think about other types of assistance that the government provides people, such as a tax break for owning a home, a mortgage tax deduction, that also is a choice we have made, and people benefit from that. And so I know I'm veering into a little political territory here, but I think it is important just to say that these are all choices that we as a society make. And can also make decisions to sort of undo some of these things.
So Alana's told me it's the last question. So I want to thank both of you, Dr. South and Loree Jones, for giving your time and your work. And just to underpin that, I think if we leave you with any message, it's that we have serious health and well-being needs in this region that are reflective of the inequities created by structural racism, and that they can be solved, and that using greening as a sort of must have basic part of the infrastructure of our lives is an important way to make change. And there's a lot of research and action happening here, enacted by University of Pennsylvania, PHS, Philabundance, and others. And if you're inspired by the best way to help is to get involved with time, with money, with advocacy, with effort. So thank you for your time, both of you, and thank you all for joining us. It was good to be together.
Thank you, Matt.
Thank you.
All right.